that one time I left healthcare? You've thought about it. You get so frustrated and so burned out and so over it, probably thought about it. So we're just going to talk about it. Welcome, my brilliant leaders. You are the ones leading the way in healthcare. You are the ones that are the most brilliant, that care the most, and you often are the ones that are feeling the most suppressed by the system, the most like a failure, the most like you just can't do what you're here to do. From the outside, people see that you're a healthcare provider, that you're a physician, that you're a surgeon, that you've achieved this dream, but you know that there's more. You know that you can be a better resource for your patients, and you've done everything you thought you were supposed to do to be a better provider. But the thing is that often is actually making you a better employee, which is more manageable and more manipulatable. Funny how those words are similar, isn't it? Instead of actually being a better resource for your patient. So I'm telling the story today about what led to my leaving healthcare and then what brought me back to healthcare, and how with that, I help you be clear on where you're headed and have the momentum and have the energy to do it, because in this state so many are so exhausted, both physically as well as in your soul, like deep in your gut. This feeling of defeated and feeling of failure is a really real thing. We call it burnout because that's the socially acceptable word to say, but it's more than just needing a nap. It's exhausted, soul tired, and being I don't want to say afraid, hesitating to put more effort or more energy or more time or more financial investment into trying to get to that place, because you've already done so much and it got you where you wanted to go, but it didn't. Right. I was in healthcare for 20 years. I've done everything from front desk to being a provider. I have over and over and over again figured out how to do this in a way that the patients feel more heard and more cared for the providers were less stressed, and revenue increased. And you get told over and over and over that you can't do this. So I figured out how. But let's go back to the beginning, because I get excited and then I start out this. I was actually in the hospitality industry. I was in event coordinating for a number of years prior to getting into healthcare. So I was in event coordinating. And then the next step was outside sales. That was the next promotion in hotels. And I did that. I took that job, or I had increased bookings over the year prior, and still wasn't good enough. I wasn't kissing enough fast, actually. The chef decided that he didn't like me. I was young and I was a girl, and who was I to be telling him how to do his job? I wasn't telling him how to do his job. I was coordinating and I was going off his menus and I was asking questions and I was working with him, but I wasn't groveling, nosing. I wasn't bringing the bottle of whiskey that I was supposed to be bringing, and I wasn't doing these things. That's why I was supposedly let go. Even though my numbers were great, it wasn't enough of this playing politics. And I was looking for a job where I could just do a really great job of doing my job and have it be enough. But I found a position at a front desk at an eye clinic. I thought, cool, I'm just going to do this and it's going to be great. Come to find out, with my background in coordinating and administrative tasks and event situations, they wanted me to go into the surgery coordinating office. That was a position where I actually had quite a bit of autonomy, and I worked in partnership with the provider, which was wonderful. And I loved that. And I could build these relationships with these patients. I was able to educate and then listen to them and really help them know what they were saying and what they wanted so that when they spoke to the provider, they could have a conversation where they felt like they were prepared for it and could make the decision for them. That's what we want, right? It was a great position. I had been there a number of years though, and knew that there was a lot more to learn and that there was a lot of different ways to do things and a lot of different subspecialties. And I wanted to expand what I knew. So my healthcare career went from there. Searching for that position where I felt like I could do the most good, where I felt like my skills and my abilities would be appreciated, where my increasing patient satisfaction and revenue and decreasing provider stress that I had realized that I could do time after time would be appreciated and desired. I was hitting a frustrated point where I was feeling like a failure that I couldn't find this, that I couldn't create this. I was coming up against this system where that just wasn't how it was. And I started thinking that I would be able to better help patients outside of the healthcare system, potentially in some sort of a mentoring or a coaching role or a patient education, patient advocate type of a role. I wasn't sure, but I knew that I wasn't doing the good that I wanted to do in healthcare anymore. And I was at a position where it was starting to really not pay the bills at all anymore. I was going to the food bank for supplementing what I was making. I was working as many hours as I got for it. And I had the conversations. Hey, I get it. I've doubled your revenue, but you can't give me a raise. Fine. But can you at least make my schedule regular so that I could get a part-time job to supplement the income? And I was told no, that they couldn't do that either. There were just a lot of things building up. And then it was a really cold winter, and the electric bills and the heating bills, instead of being high, like winter high for a few months, it was 6 months of these really high winter bills. And it was a blizzard in May, and my power got turned off because I was doubling clinic revenue, but I couldn't take care of the patients the way I wanted to take care of the patient, and I couldn't keep the heat on in a blizzard. It was the moment that I was putting my dog's coat on him that I realized that that wasn't for me anymore. About face, I left healthcare shortly after that. Over the years, I learned a lot more and I studied a lot more, and I had a chance to heal some of the wounds that led me to that place and got over some of the trauma in healthcare. When I considered coming back to help healthcare providers and to come back to healthcare, there was a lot of tantrums. I had programs about leaving healthcare. I had programs about recovering from addiction to healthcare. And the idea of coming back to healthcare, coming back to help providers stemmed from remembering how incredible some of you really are, how brilliant and how caring and how compassionate some of you really are. So I went back to healthcare to see, as an employee, to see if I could do it, to see if the what I had over the years of being away from healthcare, if when I applied those worked, if I could do healthcare again and not feel burnt out, if I could do healthcare and feel like I was helping patients in a way, if I could go back to this career that I left in a not happy place. It was not a good place. Could I come back to an unhealthy system and keep myself healthy? And it worked. And not only did it work for me, it's worked for provider after provider after provider. So I know it can work for you. And I know that those of you that are here are the ones that care. You are the ones that are the most brilliant, that are feeling the most suppressed by the system, that are in secret because we can't tell, right? Feeling the most like a failure, feeling the most burnt out, the most something's got to fucking give here. And it can. And I've taken everything I learned and all the experiences that I had, and I put them together in a way that it's complete, but it's concise. Yeah, it's taking all of that spiritual work that I did, all of that healing, all of that, and putting it together, but in a focused way where it helps you develop with clarity, lead with confidence, and expand in deep comfort. It's possible. Kept the cost low. I kept the investment of time and effort as low as possible. It's there for you. I called it brilliant to help you remember that you get to let your brilliance shine. Your dream practice is not only possible, it can be inevitable. Your work can be the delightful, fulfilling, fun, authentic, prosperous, and profitable career that you dreamed of. Can help people and stay healthy yourself. Can be the resource for your patients that you want to be. Now, it's going to take some irreverence. It's going to take some choosing. It's going to take building some systems and structures to support you. It's going to take some protecting of your dream. None of it has to be hard. None of it has to add extra stress. I know you're tired. We're just going to refocus that, redirect that effort that you're already putting out. Can take more, just different. Can do this. I know you can. I know you can be the provider you want to be, the physician you want to be, the chiropractor you want to be, physical therapist you want to be, the eye doctor you want to be, the pediatrics doctor you want to be. It's possible. I'll see you soon.